This week, we're covering one of my favorite subjects. We're going over practice vignette style questions. If you need help preparing for these type of questions, make sure you check out our mock exam 1, 2, and newly mock exam 3. This week, we're going to be covering some vignette style questions to hopefully help prepare you for your upcoming exam. So what will happen is we will give you a vignette style question. I'll give you 1 minute to answer, and then we will go over the answer. All right, are you ready? Here we go. All right, that's about halfway through, so I'll let you have a few more seconds. Now remember, when doing vignette style questions, we suggest about 1 minute and 10 seconds each per question. Okay, let's review the answer. The answer to this question is B. The frontal or coronal plane divides the body into anterior and posterior sections. So if you think about it, the patient is experiencing a decrease in range of motion in the frontal plane. When you move your arms in the frontal plane, we would see abduction and adduction. So therefore, they have a decrease in that range of motion. All right, let's move on. Here's 1 more minute on the clock. Okay, let's review the answer. The answer here is C. Now, the muscle length assessment technique for the pectoralis minor is contraindicated if the patient has a history of posterior dislocation of the glenohumeral joint. So it's really important that you understand your special tests because this will give you a better idea of, is this position that you would test pectoralis minor in that position. So the starting position for this test has the patient supine with the scapula over the side of the plinth and the shoulder in external rotation and about 80 degrees of flexion. I encourage you to look this up if you can't really make a clear picture of what this looks like. The elbow is also flexed. So in this position, this is pretty much identical to the position for the apprehension test for posterior shoulder dislocation. And so that's why we avoid this test or testing the muscle length of pectoralis minor if there is a history of posterior shoulder dislocation. Okay, last one, 1 minute on the clock. Okay, let's review this answer. So knowing this means that you're well aware of your goniometer placement. And remember, when you're looking at goniometer placement, you want to think about where the axis should be, where the stationary arm should be, and where the movable arm should be. And you can also think about where you should be as well. But in this question in particular, we're asking about the goniometer axis. And so it should be placed at the lateral aspect of the center of the humeral head, about 2.5 centimeters inferior to the lateral aspect of the acromion process. Now, the goniometer stationary arm is placed parallel to the lateral midline of the trunk, and the movable arm is parallel to the longitudinal axis of the humerus. Now, as important it is to be able to visualize this, you really want to be able to remember what it is as it's written down, because on your written exam, there's likely no pictures. All right, thanks for joining me. And if you have any questions about this, make sure you check out our courses as of October 1st, as we will have handouts for goniometry measurement and manual muscle testing. Thanks for joining me.